Hi, my name is Fennell Belfort, and today is the 4th. So for this video, we're going to be talking about one of the systems that I find more interesting to me, and that would be the muscular system. Well, really the skeletal muscular system, since the three separate tissues that make up the muscular system, you have skeletal, cardiac, and smooth muscle. I'll be focusing more on the cardiac part of it because I like talking about the heart. So that's the organ I'll be focusing on. But I have the skeletal model here just to make me some references from the anatomical positions to the heart. And then any notes I'll be using will be basically like a checklist of all the things I'm supposed to be going over, pretty much. So like I said, an important organ, like a component of the muscular system, will be the cardiac muscle. And cardiac muscle referring to ideally to the heart. As we all know, we can't function without that. So, and we use our muscles throughout the day. We can't function without basically our muscular system. That's why to me it's always been an important component. Even as an optometry students, I'm learning about the eyes, but we still need our muscular system to help us with eye movement, me looking up, down versus side to side. All that requires movement as well. So focusing on the heart, which is the organ I'll be talking about today, 5 important landmarks of the heart would be the right atrium, the right ventricle, the left atrium, the left ventricle, and then you have the aorta. Of course, there are other components of the heart as well, but for now we'll just focus on that. Anatomical positions, if I'm using the skeletal here to make references, if the heart is on the left side right here, your head would be superior to the heart, relative to the heart. If I have my sternum over here, the sternum, if this is the midline, the sternum is more on the medial side, whereas the heart will be more on the lateral side. Your legs are inferior to the heart. Your spine would be more posterior to the heart. So those are just some of the references as far as anatomical locations relative to the main organ I'm focusing on. Specialty as far as surgical and clinical specialties or the study that deals with the heart or cardiac muscle, that would be cardiology. Now to separate them, the main specialist for cardiology would be a cardiologist. So any type of treatment diagnose that you have to do with the heart or cardiac muscle, you would go to a cardiologist. On the medical aspect though, a cardiologist is technically not a surgeon, so anything surgical related would be more of a cardiac surgeon. So if you have to do surgery or anything like that on the medical side, that would be more of a cardiac surgeon. Versus like a clinical aspect, even though it is a medical profession, our cardiologist will be more on the clinical side, but not so much the surgical aspect. But they do diagnose, treat, in any component that has to do with the heart. What other things? Well, I believe that's all the main components that we're supposed to be going over. Like I said, this one was a little bit more broad because I do want to talk about the skeletal system, but ideally I wanted to focus more on the heart because that's an organ that I like talking about, as it is part of the muscular system, which is one of the most important systems that's important to me. So that's why I chose to talk about the heart.